Hello.
Hi.
Just wash my hands here. All right. I'm Corey.
Corey,
I'm going to be your nurse practitioner student today.
nice to meet you.
How are you?
I'm all right.
Good deal. Okay. Well, why don't you start by telling me a little bit about yourself and what brought you in here today, Mr. J?
I fell and I hit my shoulder about 3 weeks ago. I was out messing around with the dog and I just slipped and fell and hit it, and it was hurting really, really bad for a few days, and it's gotten a little bit better, but I've still got some lingering pain that just won't go away,
Okay.
and that's why I came in.
Okay. All right. And can I call you Jay?
Yeah, you can.
Okay. Great. So, are there any concerns about your shoulder that you've been having specifically that you can think of, like maybe what's causing it, other than the fall?
No, I just think it has to. I mean, literally, I fell and it started hurting immediately that day. I don't think I separated it or dislocated it or anything like that. It wasn't like excruciating, but it's been very sore.
Okay. How was your range of motion right after the accident?
I have full range of motion, but whenever I'm reaching for things over my head, in kind of this area here, the pain's a lot worse.
Okay. I got you. So when you have your arm up,
Yeah.
it hurts worse. Okay. Are you feeling any what we call crepitus? It would just be like a crunching or kind of a
Yeah, I feel a little bit of that. I can kind of feel
Yeah.
I don't know, the ligaments of the tendons kind of rolling around when I move
Okay.
my arm some.
Understand. Okay. Let's see. And so whenever you fell, can you explain how you fell? Did you trip or did you feel dizzy? And
I was walking the dog on the leash, and she just kind of like got real excited and ran around me and ended up taking the leash around me, and I was trying to get out of it, and I just fell right on this shoulder, right on the side.
okay, I understand. And can you describe the pain immediately after the incident to me? How much was it on a scale of 0 to 10?
It was like an 8 or 9. when I
Okay.
did it.
And what did it feel like? Was it dull, achy, burning, cramping?
Yeah, it was just this dull, aching pain. I mean, it just, that's the best way to describe it.
Okay. And did it radiate anywhere else? Did you feel it in your collarbone?
No,
ribs,
it's just
anything like that?
localized right there.
Okay. Any trouble breathing right after the accident or anything like that?
No.
Okay. And now describe the pain that you're feeling now on a scale of 0 to 10 as opposed to when the accident initially happened.
Yeah, when I'm at rest, when I'm not doing anything, it's about a 5. But as I go to the gym and I like to do weight workouts, and
Okay.
when I'm trying to do weight workouts and do some of that stuff, it's
Mhm.
more like a 6.5 or 7.
Okay. And is it a constant pain or just mainly when you work out?
Well, no, it's a lingering pain, kind of all day. It's about a 5, but
Mhm.
whenever I'm trying to exert myself physically and be active, it's more like a 7.
Okay. Gotcha. And again, does it radiate anywhere or do you feel anywhere else? Not have any issues breathing?
Just in the shoulder.
Okay. Great. Are you taking anything for that shoulder pain medication wise?
Yeah, I'm taking ibuprofen.
Ibuprofen?
Yeah.
Okay. And how much ibuprofen are you taking?
3 pills. I think they're 200 milligrams twice a day.
Okay.
So like in the morning and then in the evening.
Okay. And is that helping with your pain?
A little bit. I mean,
Okay.
some.
On a scale of 0 to 10, how bad is your pain after you take the ibuprofen?
When I'm not doing anything, it's probably still a 4 or a 5.
Okay. Are you doing anything else for the pain, like ice,
No.
wrapping it, compression, anything like that? Okay.
No, I haven't done any of that kind of stuff.
All right. Let's see. Do you have any allergies to any medications?
Nope.
Okay. Latex allergy, iodine allergy,
No. No allergies at all.
food allergy, dust.
No.
Okay.
Bad attitudes.
Okay. I can understand that. Yeah. I'm right there with you. Sometimes you won't get any of that here.
Good
I
deal.
can guarantee you.
Good
Okay. So you taking any over-the-counter medicines besides the ibuprofen?
No.
What about prescribed medicines?
No, I don't take anything.
Okay, nothing herbal.
No herbs, no alternative medications, anything like that.
Great. Okay. And what about surgeries?
I had my tonsils taken out when I was about 7.
Okay. And what led to you having your tonsils out? Was there an illness? Just
I don't think
tonsillitis?
so. I don't remember.
Okay.
I can't remember if there was some particular reason why they did it.
Okay. I understand. Any other hospitalizations other than the tonsillitis?
No, that's it.
Or tonsillectomy, rather? Okay. What about childhood illnesses?
No,
Any adult illnesses?
no.
No? Okay. Any other injuries that you've had besides the shoulder?
No.
No? Okay.
I mean, a couple minor injuries here and there playing sports in high school, but nothing
Right.
nothing serious.
Okay. What type of injuries were those? Just
I hurt my knee for one time for a couple days, but nothing serious.
okay, nothing that you ever followed up.
No, I didn't
The
see
doctor?
any. I didn't see any type of. I didn't see anybody for it.
Okay. If we'll definitely assess you need later if you have any lingering issues with that, let us know. Okay.
All right.
Let's see. As far as your health maintenance practices, how's your immunizations? Are those up to date? Have you had a tetanus shot in the last
Yeah,
few
well, I'm a
years?
registered nurse, so I've had all that kind of good stuff.
Okay.
Yeah.
Flu shot you've had?
Yep.
Okay. Pneumonia?
I don't think I've had pneumonia.
Okay. And what about all your childhood vaccines? Those are up to date?
Yes, they are.
Okay. Meningitis vaccine?
Yep.
And I know you said you had those already, but we like to be
Yeah.
thorough and just get a yes or no from you just to make sure we're getting it all correct. So, all right. Now, what about environmental issues? So, do you feel safe at home?
Sure.
Okay. What's your living situation like?
Got a couple roommates, live in a house.
Okay. Great. What's your neighborhood like?
It's safe. It's it's an older neighborhood. It's up in North Austin.
Okay. And then, so your roommates, or you guys have a good relationship? You help each other out with things?
Yeah, absolutely.
Okay. Great. Do you have any alcohol history?
No, not particularly. No,
Okay. Good. Any history of drug use?
not at all.
Okay. And then any history of tobacco use?
No.
No. All right. What about your family history? Tell me about your mom. Does she have any medical history?
Depression. That's about it with her.
Okay.
Excuse
What about your dad?
me. He's on medication for hypertension and dyslipidemia, and he's had a full knee replacement recently.
Do you know why he had to have a knee replacement?
Just an old injury from when he played football in high school. He hurt it and never really got fixed right. Surgery back then was kind of crap.
Okay, I understand. All right. What about your siblings? Do you have any siblings?
One older brother.
Okay. Sorry, how old, let's backtrack a little bit. How old is your mom?
She just turned 64.
64?
Yeah, she was born in 52. She just turned 64.
Okay, and what about your dad?
He's 66.
66?
Or he'll be 66 in a month.
Okay, and they're
So-
both still alive?
Yeah.
Okay, great. And then, so tell me about your brother now. Go
He's
back to that.
40.
40 years old?
Uh-huh.
Okay. Great. And does he have any medical problems?
He takes medication for depression and hypertension.
Okay. All right. And then, do you have any other siblings?
No, just him.
Okay. And what about your dad's mom?
She's still alive. She's like 84, I think.
Okay.
She takes medication for hypertension. She lives in a independent living facility. It's kind of like and she has her own little apartment.
Okay.
Most recently, she had a UTI,
Okay.
and she had some co-occurring psychosis. But I'm not really that. Like, I don't really know much beyond the hypertension with her. Like, if there's any type of health issues with her.
Okay. And you think the psychosis was just related?
It was related to the UTI, but
Okay.
it's still they gave her antibiotics for the UTI and
Okay.
they've fixed that, but she's still having some cognitive issues.
So other than the urinary tract infection, she has some at baseline?
Yeah.
Or just is normal?
Yeah,
Sorry to hear that.
yeah, it sucks. My parents are kind of not sure what they're gonna do.
Okay, so, alright, what about your mom's mom?
She's still alive. She's about the same age as my dad's mother. She's probably 80 something, 85, 84. And I really don't know much about her. She had heart surgery recently,
Okay.
this past year. I think she had bypass surgery.
Okay.
Yeah, that's about all I know. I don't know if she takes any meds for anything else.
Okay.
I mean,
You're not
she had a
sure?
broken hip. She fell and broke her hip.
Okay. Are you not sure why she had to have the bypass? Was it a faulty valve or was it a vessel issue? Okay. No problem. Alright. And what about your mom's dad?
He died when I was pretty young. I think he was in his,
Sorry to hear that.
yeah, I didn't really know him though. I want to say mid 60s, early 60s. He was a real heavy smoker, and he died from complications from smoking.
Okay.
He had emphysema and I guess COPD, or I don't know if he ended up actually dying from a heart-related issue or I don't know.
It'd be tough to see a loved one go through that.
Yeah, it got bad. He got to the point where he had, the oxygen tank and all that kind of jazz.
Wow. Sorry to hear that. Well, let's move on to your dad's dad.
He died when I was young too. I want to say I might have been 10 or 11. I was a little bit older than when my mom's dad died. He was on dialysis and he had Alzheimer's. And I'm not sure exactly what the cause of death was. But he had been on dialysis for a long time. And he had Alzheimer's there at the end also.
Sorry to hear that. And my grandfather had Alzheimer's too. It's hard to watch him go through that progression.
Yeah.
It really is.
Yeah. Luckily, I was still pretty young. It was all, I don't know.
Yeah. Okay. I noticed a lot of, well, let's see, 1, 2, 3,
Hypertension.
4. Yeah, a lot
Yeah.
of hypertension in your family. Have you ever been?
Yeah, my blood pressure's fine.
Okay.
I've had it checked regularly, and I'm consistently 120 over 80, 125 over 85.
Okay. Great. Very good. Okay, moving on here. So, have you had any weight gain or weight loss in the past 2 years or year that was unintentional?
No,
Or even the last month would probably be more of a
no.
great question.
I mean, I've done diet and exercise to lose weight, but nothing that's been unintentional.
Okay. You haven't noticed any clubbing or
No, my nails. No,
odd
nothing.
color
like
in
that.
your nails? No lesions on your skin?
No.
Nowhere? Okay. Have you had a headache or dizziness or anything like that that you've noticed?
I have not.
Okay. Do you wear glasses or
I
contacts?
do not.
Have you noticed any visual changes? No?
No.
Okay. Any ringing in your ears or discharge?
Nothing like that.
Okay. What about cold symptoms or stuffiness?
No, I'm pretty healthy. I mean, don't even have allergies. Don't even get seasonal allergies.
Oh, that's good. You're one of the lucky ones around here.
Yeah, no kidding.
All right. So what about tooth or gum problems? No issues?
Brother's a
there?
dentist. He takes care of all that.
Wow, that's convenient.
Yeah, it is.
So what about bleeding gums?
No,
Any swollen glands in your neck?
nothing I'm aware
Neck
of.
pain?
Nothing.
Okay. What about chest or breast discomfort? No. Coughing, wheezing?
No,
Okay. What about how do you sleep? Do you sleep on one pillow or two or three?
One.
One pillow. Very good.
Yep.
Have you ever had a EKG or a stress test?
I have not.
Okay. Good deal. When was your last bowel movement?
Earlier today, about 10 in the morning.
Okay. And when's the last time you had something to drink?
I'm hydrating right now.
Okay. Great. And when's the last time you had something to eat?
5 o'clock.
Okay. 5 p.m.
5 p.m. Yes, sir.
Okay. All right. Have you noticed any rectal bleeding or hemorrhoids?
Nope, nothing like that.
Okay. Any cramps in your legs or any history of blood clots? No. Okay. Any pain when you urinate?
No.
Okay. Any history of hernias or discharge?
No.
Any scrotal pain or swelling?
Nope.
Great. Now, I'm going to ask you about your sexual history.
Okay.
Just so you know, none of this is shared with anyone. except
Sure.
For, people in the office here
Don't ask away.
or involved in your medical care. Any STDs or infections that you're worried about? Okay.
No, I'm not.
Okay. How many sexual partners have you had in the past 5 months?
2.
Okay. And what about the last 5 years?
7.
Okay. And do you use condoms regularly?
My ex-girlfriend was on birth control, so we didn't use condoms. And then the other person that I've been with, yeah, I use condoms with that person.
Okay, great. And let's see, how long were you and your ex-girlfriend dating out of those 5 years?
Off and on for 3.
3 years. Okay. And have you ever been tested for STDs?
Yeah, maybe 5 or 6 years ago, I got tested.
Okay.
Everything was negative.
Okay. No concerns about HIV or?
I don't have any concerns about HIV.
Okay. Great. Let's see. What's your salt intake like in your diet?
I would say moderate.
Okay.
I don't really find myself salting many foods, and I'm pretty watchful and mindful of what I eat.
Yeah.
I don't eat a lot of salty snacks, but
Okay. Yeah, with your family history, that's an important consideration. I think it's good that you don't salt your food too much. What about your caffeine intake?
I drink about 24 ounces of coffee every morning.
Wow.
And I don't drink sodas, and I don't have coffee after probably 10 o'clock in the morning. But in the morning, I have 2 big mugs,
Okay. And you brew that at home, or is it like
Yeah, I brew
super
it at
strong
No, I brew it
Starbucks
at
kind
home.
of deals? Okay.
Kind of a coffee snob. I mean, I like good coffee.
Okay.
Yeah,
There are worse things to be.
yeah right?
Yeah. All right. Good deal. So we asked about your immunizations already.
Mm-hmm.
We asked about your pain medicine. So what is your level of education?
I'm master's prepared.
Okay. Great. And I know you said earlier, I believe you're nurse practitioner?
Yes, psychiatric nurse
Okay.
practitioner.
Very good. Where'd you go to school?
University of Texas.
All right. Hook 'em, huh?
Yeah, go Horns.
Good deal. All right. So, and we talked about your living situation. Is there any secondhand smoke in your house?
No, not at all.
No. Great. No family history of diabetes?
Excuse me, no,
No.
not that I'm aware of.
Okay. Family history of obesity?
I mean, my dad's overweight.
Okay.
I'm always kind of getting on his ass about trying to get in better shape, but he's kind of at that age where he just does what he wants to do.
No, I understand. Dads can be that way, upset in
Yeah.
their ways sometimes. So.
But I wouldn't say there's a family history of obesity.
Okay. What about cancer?
No, not that I'm aware of.
Any thyroid issues?
Never heard of anybody having any thyroid issues.
Okay. What about substance abuse issues?
No,
Okay. And family history of headaches,
nope,
fainting in your
No.
family?
not that I'm aware of.
Okay. And just ask you, have you felt any stress or anxiety in the past few weeks, more than normal?
No, not really.
What about in the past year?
Well, I mean, I just completed my master's program, so the
Okay.
last couple years have been pretty stressful with school. But I think that's to be expected. Do you know what I mean?
Sure.
I don't think it was out of the ordinary.
Okay. You never had any chest pain or sweating or
Nothing like that. No signs of a panic attack or an anxiety attack or anything like that.
okay.
Just
Great.
tests and projects and deadlines and due dates and you know what I'm talking about.
I know exactly what you're talking about. Yes, sir. Unfortunately, but it's all for a good cause, you know.
Yeah, I'm just I feel very relieved now that it's all over.
Yes, I'm sure you do. Pays off in the end, doesn't it?
True.
All right. Great. That's good to hear. Okay, so I asked you if you felt safe at home, but do you have anybody that makes medical decisions for you in the event that you can't?
I don't really have anybody designated, but I guess I probably should do something like that. Maybe my mom or somebody.
Your mom. Okay, so we could maybe help you get a living will or power of attorney set up, or give you some resources to.
Yeah,
help
if you
you
want
do
to. I'm not really interested at this time, but whatever.
Okay, sounds good. No problem there. It is something to consider though, because sometimes we get in situations that we don't foresee. God forbid,
car
but-
accidents or what have you.
Yeah, anything like that, you know. But you know, it's good to have a plan set out for in the event that does happen. And nobody likes to think about those things, but sometimes it's a good thing to do. Okay, well, great. I think we have a good picture of what's going on here, and you know, if we have any more questions, we'll definitely come to you with those. We'll definitely, I think, do some X-rays on your shoulder and try to figure out what's going on in there. We'll do some lab testing, you know, just to, just given your family history here, and then your age, we 30, 38,
39.
39, okay, sorry,
It's okay.
39, I think, you know, it'd be good to establish some baseline lab work, just especially with your history of hypertension.
Like lipids and stuff.
Yes, lipid panel.
Cholesterol.
Yes.
Sure.
Absolutely, and just check your organ function. You know, check a CBC. Just to make sure everything's at a normal level. And other than that, just establishing based on labs and making sure your shoulder is doesn't have any structural damage. I think it'll be good. You know, if it doesn't, then we'll just kind of take it from there. But probably continue icing it, resting it. If your pain persists, I'd say past, you know, 3 months, we'll probably, you know, try to keep your pain at bay in those 3 months. But if it becomes a chronic issue, we can definitely take it further and do an MRI or, you know, have you see be referred to a different type of physician. So. But we'll cross that bridge when it comes.
Sure.
Anyway, any questions or concerns?
No.
No? Okay.
No questions.
Was there any religious or cultural practices that you wanted to observe during your care?
No.
Okay. All right. Well, if you have any questions, feel free to call me. Okay? It's great
Sounds
to meet
good.
with you here, and we'll get your physical assessment done here in just a bit, okay?
Thank you very much.
Yes, sir.